Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. Today we are talking about the importance of the facial balance and specialized in cheek aesthetic voluminization. This patient came to my office looking for facial improvement, and we clearly see that the nose make a big protagonism in the facial balance. Also the nose, this nose is big and the lip disappear for the volume of the nose. But if we see in the cheek area, we can see the malar in this area have less volume than in this area. Here in a close view we can see no lips and a big tip of the nose, and also we can see the lack of volume of this cheek and less volume there. This is the patient in the post-operative. We can see the result of the aesthetic rhinoplasty. We can see that the tip of the nose is thinner, aesthetic improved a lot, the lip appear, but we have no volumes in the cheek area. We can see the nice result, but the patient don't look beautiful yet, because the problem here is in the cheek balance. This is the post-operative rhinoplasty, and the patient comes for evaluation, and I suggest to increase this cheek, this malar, with 2 syringes of hyaluronic acid, and in this area just 1 syringe of hyaluronic acid. If we can see the acid asymmetry here, for this reason I prefer to put two syringes here and 1 here. Also we can see what is called tear, because the tear comes from here, tear through, or lacrimal channel. More clearly is seen here, and in this area have no tear through. Here we can see clearly. And this is the patient after 2 minutes of treatment. I put ice here, a pack of freezing, and I inject near to the bone hyaluronic acid with heavy chain, and this is 2-minute procedure. Not painful, no downtime, but the difference is very remarkable. If we see this patient, I can say this is a patient of lack of harmony, and here is a patient that have harmony. Maybe the chin is not harmonic. I think in the future maybe I need to make some filler here because it's displaced. But the improvement in the central of the face was very impressive, just with a very quick procedure. We can see here the distance from here, and here is Sometimes the patient come for dark circles, and they need just volumization of the cheek, because when I voluminize the cheek, the distance of the lower eyelid is shorter. You can see the distance from here to here is not the same to here to here. Here we can see the tear through, and here we can see the voluminization of the cheek and how the lower eyelid was shortening for the voluminization of the cheek. Here is the post-operative. This balance. The aesthetic concept is to give the face a nice, natural, and beautiful balance.